Hi everyone! Today, we're very excited to talk with you.
Today we have lots of dental myths for you, and I think we should just get right into it.
Let's go.
Okay, I have a good one for you.
All right.
If your gums bleed when brushing, you should stop brushing.
This one always gets me because people do it so much.
Yeah.
They say, it was hurting, so I stopped. And I'm like, no, you should keep going. So what happens is our gums bleed because they're sick. So we need to protect them. So we need to keep going, cleaning so that they can heal. So that is definitely a no. Okay, this one's for you. You ready?
Okay, I'm good.
Okay, you can straighten your teeth with rubber bands at home.
Oh my goodness. Please, please, please don't. You can if you put the rubber bands, but the problem is there's no wire. So all of a sudden, yeah, you've closed the space, but then all of a sudden you have rotations and all these crooked teeth. And then as soon as you take them off, you're just gonna have spaces again. So really don't do it.
Okay, very good info. Let's go.
Sugar-free drinks are safe for your teeth.
I understand why people assume that, but it's actually not. Like soda, it's acidic, the pH is very low. So since it's sugar-free, it doesn't mean that it's very good. We should still be careful about what we're drinking. And this one is coming for you.
Okay.
Okay. Orthodontic treatment is just for looks, you say. What do you say?
It is very much about looks. There's a big portion of it, it's just to fix crooked teeth. But the thing is, we definitely look at function, and that is so important. Your occlusion is how you chew, how you bite, and so function is really, really the main portion of it for us, at least for orthodontists. It
affects the patient's life comfort, can we say?
Yeah, for sure. Yeah. Your jaw, your TMJ pain, if you have pain, maybe that could be because of the occlusion, because that's not proper.
That's actually one of the things that I, as a non-orthodontic doctor, take a look at while referring patients to you. Anyway, that's another day's subject.
That's another day's topic.
Yeah. All right. I think it's your turn? My turn?
Yes, it is my turn.
Okay.
Ready? You don't need to go to the dentist if nothing hurts.
Sorry, guys. No, you should still come. Because sometimes our teeth carried away, or we have gum problems, or we have like a cyst in the bone, and we do have not any symptoms. So it's very important to see general checkups. And even patients don't want to have an x-ray if it's like a year ago. But we want to take a new x-ray in every 6 months. We can detect something that we haven't seen before, maybe just newly arise. So it's important to see for a checkup, guys.
Yeah, and even for cleaning, I would say you can't, you wouldn't feel pain for that. So even if nothing hurts, come.
If we do a general cleaning once in 6 months, and every 6 months passed, it's going to be more comfortable for you to have the cleaning because your gums are healed like a lot. And we can also track your oral hygiene routines. We can fix where is left behind. It's important.
Yeah.
Okay. Ready?
Yes.
Clear aligners are faster and easier than braces for everyone.
Not for everyone. Clear aligners, they can be very quick and effective, but the thing is there really isn't a difference between braces and clear aligners. We can only move the teeth so fast inside of the bone. It's not like clear aligners, push teeth faster in the bone. And if they do, that's not a good thing because you can end up with root resorption. So,
do you have like specific criteria for choosing clear aligners over braces, or?
Yes, we definitely do. And that again is a different whole another topic.
Okay, we'll talk about it another time.
Yes, but I can get into it a little bit. For one, there are certain movements that clear aligners do better than braces. And the other really like main important thing is compliance. Maybe that patient just isn't disciplined enough to wear clear aligners all day. Maybe they'd just be better with braces. And so that really is an important factor.
Changes from patient to patient.
Okay. Oops. Next one is...
Drum rolls, please.
Once a cavity starts, it can heal on its own.
I wish. I wish that would be true.
Yeah.
That would be a lot easier for me.
That would be great for us.
I mean, I could just be more relaxed in everyday life.
Yeah, maybe you could vacation more.
Exactly, but no. Unfortunately, no, guys. But I can make a clear statement about this. So the cavity starts with animal surface change. Once the top layer starts to fall down with like micro dosages, the calcium is like a crystal form. And with the cavity, the crystal is getting loosened down, and it goes down and down and down, and we have a hole, a cavity. So if you catch the cavity on the surface level with the animal changing, you can stop it with the fluoride. But if you pass down that stage, there's no way. We have to fix it. So I wish.
I wish too.
Yeah. Okay. This one's good. Let's go from the decay. Braces cause tooth decay.
Yes, if you don't brush, but that isn't just because of braces. You know, if you don't have braces, you could still cause tooth decay if you don't brush. So it's all about hygiene. That's the only thing is hygiene, how you brush.
Routines.
Okay, last one.
Okay, I'm ready.
Flossing isn't necessary if you brush really well.
That also makes my heart stop. I think in our country, I mean, we're speaking English right now, but we're Turkish. We're living in Turkey, and we're seeing Turkish patients, a lot of Turkish patients. We don't have that culture in here. So I think that's very sad. We should add it in our education system. What is lack is that brushing is so important, but it still cannot reach all the contact points. So the brushing and flossing is actually changing different surface areas. So a completely different importance. We have to use it, guys. Just brushing is not enough.
There's no negotiation.
No. End of the topic, unfortunately. For you, I know it's a lot of work. I mean, think about it. You're living in Istanbul. Life is already too fast and too hard, and you've never used floss before. I know that it's really hard sometimes to put into a routine. That's why I think we should be more patient with our patients. So it's okay if you don't floss every day, but you should just keep going.
We're forgiving.
Yeah, exactly. Okay, last one for you.
Okay.
You're too old for braces or aligners.
No, you're not. Don't worry, you're not too old. You can come in if you want to, you know, fix your crooked teeth. We can pretty much, if you have the healthy bone, that's important, healthy bone and gums, we can fix your crooked teeth at any time, any age. It's just really all about the bone and the gums.
I think we enlightened a lot of topics today. What do you say?
I think these are good myths.
Right?
Yeah, we did a good job.
I think so too. If you have any other questions, even if it's too weird, like, right?
Yeah, we love the weird questions.
It's like enjoying to answer them. If you have weird questions, just ask us.
Yes.
We can always
We're here
answer.
to answer all the myths.
Yes. This is Dr. Melisa.
And this is Dr. Niran.
And it's very nice meeting you guys.
See you later.
Bye.